College of Medicine joins us now. She's here to answer some more of our COVID-related questions.
All right, Dr. Alexander, thanks so much for being here. How are you doing on this Friday afternoon?
I'm doing well. The weather is beautiful today.
All right. Well, we always appreciate you joining us. We're going to hop right in here. The president is protected more than anyone else in the world. He and the people around him tested every day. How do you think the virus was still able to reach him?
It's a great question. And yes, he is protected. There's a lot of safety and security around him. But at the end of the day, he's been around a lot of people, even as far back as the Republican National Convention. We've seen him around people frequently and in large numbers. And, you know, when he is around people, we don't see him wearing masks, and the people around him aren't always wearing masks, and he's not always able to socially distance. So even though he does have added layers of protection and safety and security, it's not surprising that he came into contact with this virus, knowing that you can contract it when you're in close quarters around people that may not even know that they are, that may be asymptomatic for that matter. So I believe that that's probably what's happened here, whether it's amongst the people that he works closely around or just out in public as much as he is.
The president and first lady are showing mild symptoms, that according to the president's tweet that we showed you earlier today. So what we know about the virus right now is that it affects everybody differently, it seems. Does the fact that they're experiencing the mild symptoms right off the bat maybe give us any sort of indication as to how the virus could progress for them?
That's a great question too, and unfortunately, no. We've seen people with mild symptoms progress to severe symptoms overnight, and there is no real rhyme or reason to it. So while we're very thankful that his symptoms are mild, which might comprise of mild dry cough, maybe some body aches, maybe a runny nose, all similar to the common cold potentially, although we don't know specifics on this, you can progress to a persistent cough, severe shortness of breath, high fevers very, very quickly. And then in addition to that, you add in risk. And we know that, as a matter of fact, the CDC expanded its risk categories earlier in the summer. And it's not only heart disease and lung disease and diabetes. Now it's all ages. It is those three conditions, but obesity, having a body mass index over 30, for example, being immunocompromised, those things are added to the list. Chronic kidney disease, the list has been expanded. So you add that into the ratio and it's going to be very hard to know. Luckily, he's quarantining and he's under, supervision and can monitor these things closely if they should progress.
All right, obviously we're thinking about the first family and everybody that's been affected by COVID-19. We want to turn our attention now a little closer to home. As far as North Florida and really the state as a whole is concerned, what's the latest discussion within the medical community regarding cases right now?
So in checking in with my colleagues across the state, what they said, more than one colleague responded with same old, which might sound great. And in a way it is great in regards to cases not necessarily going up, hospital rates not going up, but it doesn't mean that they're going down either. I had one colleague in Miami saying COVID-19 cases are actually going up. So while across the state, mostly I was hearing same old, we are seeing some rises in hospitalizations. Our very own TMH, compared to last week, has gone up in cases as well. And the thing about that is, while our numbers here at TMH are still low, 21 cases positive in the hospital currently, as those beds take up space, if we have more and more cases, we lose room for other people who may need it for other things. So that's where we're at this time. Kind of a same old picture, but keeping a close eye on the numbers.
Speaking of the numbers, a viewer asked about the discrepancy in positivity rates for Florida. The numbers from Johns Hopkins, which is doing its own count, much higher than those from the state health department. Why would that be?
This is an excellent question too. I've actually been researching this myself over the past week and talked to a few people about it today. The best that we can come up with at this point is how those numbers are counted. It comes down to counting. So for example, if you test positive here, but you were just visiting and you're from another state, where does that number get counted? In addition, what is being counted as a positive number? We know that we have antigen tests, PCR tests, and antibody tests. Antigen tests and PCR tests tell you about active illness right now. If you're positive for one of those tests, you have coronavirus. Antibody tests only tell you about exposure. At some point you've been exposed or maybe had the virus. If you're including antibody tests in those numbers, it skews the data. So that could be a potential area where the numbers are off. And lastly, if the data isn't being scrubbed properly, and what that means is really looking at it and making sure you're only counting one positive case as one positive case, things like that, that can skew the numbers as well. So as best as we can tell, it all comes down to how that information is collected and how that information is counted.
Gosh, we sure do appreciate your clarification week after week on so many topics pertaining to COVID-19. Before we go, we want to put the ball in your court. Is there anything else that you would like to add today?
Well, thank you so much again for having me, and I agree. We just wish everyone well. We definitely hope everyone recovers from this quickly and speedily. And for the rest of you out there, just remember, if you've been around somebody who has coronavirus, stay home. Get tested if you can. If you start to develop symptoms, stay home and get tested if you can. And even if you're asymptomatic and you're running to the store or have to run a quick errand, wear your mask and maintain social distance as much as you can. With that, we can all, again, be healthcare heroes and take care of each other through this pandemic.
Okay, Dr. Alexander, a perfect point to end on.
Yeah.
We thank you so much again. Enjoy your weekend, and we'll talk with you this time next week. And you can rewatch this interview and all of our previous ones with Dr. Alexander on our website, WCTV.tv.
All right, still to come.